Ako po si Sonia Kapunpon, 12 taong na nunong po na sa BHW. Sa buong maghapon, nahihikap naman ho yung kung magbibigay ng vitamin A o magtitimbang. Sa loob ng maghapon, nakakayanan. Ay wala po dito pinakamalapit na espesyalista tulad sa pag-asakit stroke. Pag ayun ang makuha na ang kanilang karamdaman, dinadala na lang sa city, Batangas City. Pag wala ng pera, kahit kailangan ng follow-up na examen, ng follow-up na check-up, ay merong hindi na lang dinadala sa merong pinaalbularyo na lamang ho pag wala nang gagastusin. Sana kung may paraan na yung mga may sakit dito sa aming barangay na walang kakayanan, na siyempre wala kulang sa financial, na pwedeng kumonsulta na madala dun sa syudad para magamot ng hindi napupunta dahil walang pamasahe. Yung dinala namin sa emergency na anak, amin ito na-transfer sa regional dahil magpapa-ligate nun kaya ngayon ay hindi nga ho nadala namin yung record, yung mga laboratory dito, di pagdating doon, pinalaboratory.
The management of health information in the Philippines is at best rudimentary and ministerial. Notwithstanding rapid advances in information technology, the error-prone pen and paper methods still predominate at the lower levels. The data flow is hierarchical, which mandate consolidation at the lower political levels as they find their way to the central offices. As a result, transparency suffers as information adverse to providers becomes distorted as data flows upward. Private sector information, particularly regarding intervention outcomes, is selective and scarce. We need to create a national council mandated to craft a health information, education, and communication master plan that is designed to maximize the use of information technology for health service delivery. This should be led by the DOH with the PhilHealth Information System as its backbone. The Council should also include the National Institutes for Health, Philippine Council for Health Research and Development, and other information agencies such as the National Statistics Office. All health providers and facilities, including those in the private sector, should be mandated to submit health reports electronically and using standard formats. One facet of inequity in health is the wide gap in education, especially among women. Public health information through mass media must reduce this gap. But with TV, radio, and print dominated by commercial interests, we aggravate the misinformation and miseducation of our people. We need to strengthen health research and generate the evidence that may be used by people and policymakers. Stronger research should inform all stakeholders, including the community, to make better decisions. Our challenge then is, are you willing to invest PhilHealth reserve funds to jumpstart an integrated health information system?
Nung magkasakit ang asawa ko, dinalagad namin siya sa ospital. Nadala namin siya sa medical center sa Top Avenue. Hindi namin akalain na ang kanya palang napuntahan namin ospital ay mamahaling ospital, private. At 9 na araw kami doon at umabot ang aming bill ng 184,000. Sa totoo lang, talagang wala kaming kakayanan na bayaran ng bill sa ospital na yon. Kaya pilit kami na lumipat kami sa PGH dahil alam namin na ang gobyerno ay may kakayanan, tulungan kami. Bali, nakapagsanla kami ng 2 titulo na yung titulo na yon ay hiram ko sa aking kapatid.
para yung aking asawa mailabas sa ospital na yon. Dati po meron po siyang PhilHealth, pero inactive po siya. Hindi namin pinagpatuloy ang PhilHealth dahil sa hindi namin alam ang mga benepisyo at saka hindi namin nagagamit. Ngayon, ang PhilHealth pala, meron din palang benepisyo, ngunit hindi naman para sapat. Wala po kaming talagang pagpupunan dahil kami, ang asawa ko, walang trabaho. Ako, isa lang akong kusinera, di namin alam kung saan kami kukuha ng pinansyal para matugunan ang gamot asawa ko sa ospital.
Minsan hindi kami kumakain dito. Kasi sa gamot ni Mama kulang pa eh. Minsan dinitesa lang namin kasi mas malaga yung buhay ng papa ko. Pag hindi po namin nabayaran yun, kawawa naman po yung tita ko. Yung bahay at lupa niya, mahihilit. Sana po matulungan naman lang po.
The 200 billion pesos that our country spends on healthcare each year is inadequate, inefficient, and for the majority of Filipinos, ineffective. Because more than half of total expenditures is sourced from out of the pockets of individuals and families, the Philippines healthcare financing system also promotes the glaring inequities resulting from the inadequacies of the rest of the health sector. In order to ensure quality health care for all Filipinos, it is clear that radical reforms should be made in the way that we as a society pay for our health services. For this purpose, government subsidies for health through national subsidies, local government allocations, and national health insurance benefits must be significantly increased to minimize out-of-pocket payments at the point of service down to a level of 20% or less. Tax-based spending, both national and local, should be increased to 80 billion pesos or more a year through borrowing, additional taxes, and reallocation from non-social service sectors. This will require strengthened coordination of spending between national and local governments. Social health insurance benefits should grow to over 50 billion pesos a year to be financed through drastically reformed premium benefit structures. This will require a radical reorganization of PhilHealth management to more efficiently reflect a social health orientation in contrast to the current standard insurance model. Our challenge in healthcare financing is, can we convert PhilHealth to a true insurance program that maximally spends its health fund on benefits to fully support the health requirements of all Filipinos? To conclude, Filipinos can now only dream about universal health care. Making this dream a reality requires three commitments at all levels. First, a quantum increase in coordinated government spending. Are we ready to increase government spending up to 5% of our GDP or more in order to meet the requirements of healthcare for universal healthcare? Second, public support for health reforms. Can we generate sufficient political will for government to expand its role in regulating, financing, and delivering health services at all levels? And thirdly, we need to have an initial focus on the poor, but keeping in mind that the need to avoid a two-tier system that will exacerbate inequity. Do we as a people care enough about each other to moderate our demands for expensive but non-essential health interventions so that we can provide for a high-quality, basic health package for all Filipinos. It is time to elevate the level of politicization of health from that of parochial self-interest and petty patronage to a national issue of common concern. The time has come for universal health care.